Welcome, everyone, and good evening. My name is Kristen Gandak, and I'm the Marketing and Communications Manager here at Lynn Community Health Center. We're so excited to have you join us tonight to do a second conversation between our CEO, Dr. Kiame Mahaniah, and actor and writer Jason Mantzoukas.
Yes, thank you, Kristen, and good evening to all. My name is Kiame Mahaniah. I'm a practicing family physician and the CEO of the Lynn Community Health Center. Welcome to our second virtual dialogue in celebration of the Lynn Community Health Center. It's very, very exciting for us. The health center has been really at the center of the healthcare landscape in Lynn since its inception 50 years ago. And we've always been responding to the needs of the community. And tonight, we'll be able to share with you both the roots of our health center and also the mission of our federally qualified health care centers, as well as what's very specific about Lynn Community Health Center. For those of you who don't know, the health center is located in downtown Lynn, Massachusetts, a post-industrial coastal city of about 90,000 people that's on the coast, 10 miles north of Boston. Our patient census currently is around 43% or 40% of the city's population. We tend obviously to concentrate on those who are the most vulnerable, both from an economic standpoint and from access standpoints. Our mission is to provide comprehensive, integrated healthcare of the highest quality for everyone in our community, regardless of ability to pay. And you have been a major part of our ability to fulfill our mission. And from the bottom of my heart, thank you so much for your support. What has really been clear, and perhaps a silver lining over the past 18 months since the pandemic started, is really how important our supporters and donors have been, both small donors and large donors. You're the ones who've helped us sustain this effort. You've been able to make us feel that we have the embrace of our community and that our work is being seen by others. And it's really helped us make it through, and it's boosted our morale and resiliency. So I'd like to thank our head sponsors. Presenting sponsors are Cambridge Savings Banks and Stainless Communications. Our major sponsors are Commonwealth Radiology Associates, Eastern Bank, Mass General Brigham. And I would like to thank all of our other sponsors for our series. And so for a complete list of our sponsors, please check out our website. On short, it's LCHC.net, so Lynn Community Health Center net.org. It's in our chat if you want to click on that. And I also would like to thank actor, writer extraordinaire Jason Mantzoukas, our guest interviewer, for giving us his time and talent, or I should say talent, for sitting down with me. A few words, Jason, before I introduce the big Mantzoukas.
It's a big day. You know, the second video this is the Empire Strikes Back of our Star Wars series. We've seen Star Wars, and now it's the middle. So this is we've got to do a trilogy. People are going to be begging for it. So we have to get that Return of the Jedi movie in there. We are merchandising off of this. We're doing action figures from these videos. Very exciting, very important stuff.
Very exciting. We even have the whole father and son theme going.
Oh, yes. Oh, yeah. You're getting, listen, if you're tuning in, you're getting 2 Mantzoukases today. So this is a pretty big day.
Yes. So what Jason's referring to is that I will be joined by our co-founder, Bill Mantzoukas, who also happens to be Jason's father. He was our first executive director, and he served for 3 years. And several years later, he responded to an invitation and was on our board of directors. And he served for 30 years as a board member. That's pretty impressive, including 3 terms as board president. And today, Bill remains a mentor of mine and a very essential member of our strategic planning committee. Bill, any words of wisdom before I introduce the video?
No, thank you. This is such a treat for me to be part of this. I saw the first video. I thought it was terrific. I love what you're doing here. Unless you have something specific for me, that's great.
I was really hoping to see like a more formidable beard on you, but no, I guess.
Yeah, that was in my past.
Yeah, you'll have to find an old picture, but he's there. It's there. He used to have a big beard. It was there.
Okay, very good. So I look forward to our discussion, and let's roll the video.
Hello, everyone. I'm Jason Mantzoukas, and I'm excited to be here today to interview Dr. Kiame Mahaniah. a practicing physician and the chief executive officer at the Lynn Community Health Center in Lynn, Massachusetts. I might seem like an unlikely choice as an interviewer, but rest assured, there is a connection here. My father, Bill Mantzoukas, was one of the founders of the Lynn Community Health Center in 1971 and served as its first executive director. I think I've been to almost every physical iteration of the Lynn Community Health Center, so I'm very much looking forward to our conversation.
I am too, Jason. I am too. Most of the time, I'm deep down into the details, so it's sort of nice to present the health center to people from the outside.
Yeah, and I think that's partially what we're hoping to do in this video is get a kind of big picture look at this organization. So the Lynn Community Health Center is categorized as a federally qualified health center. If you wouldn't mind, could you say a little bit about what exactly that means and how does that shape the mission of the organization?
So the federal government has certain rules by which you qualify to be a federally qualified health center. In general, it means that you're an institution that's dedicated to taking care of people regardless of their ability to pay for it. And the second part of it refers to sort of an administrative structure. Your board has to be 51% run by patients.
How did you find yourself here in the Lynn Community Health Center as a part of this organization? What drew you to this place?
Lynn, I refer to it as a post-industrialized, under-resourced, but highly energetic environment, meaning that there's lots of energy, there's lots of good things happening, but there's not a lot of money. I grew up in a very socially active and aware family, and the idea was always that you had to be doing something to improve the lot of the people who had less than you. So I always wanted to work changing a system, helping people who didn't have opportunities, figure out how to help them engage in those opportunities. I realized as I became an adult that what really attracted me in medicine was serving an immigrant population. And I loved the immigrant population in Lynn. I love the fact that there's over 60 languages that we serve our patients in. Lynn is a very dynamic city. The leadership of the city is very dynamic. There are resources, there are companies, there are nonprofits.
The idea that you guys are servicing patients using 60 different languages is mind-blowing. Incredible that you are able to service a community that has that much diversity. Do you have a lot of staff inside the Lynn Community Health Center who are from these immigrant communities and represent those languages or those cultures?
Yes, so Jason, that's actually one of the wonderful things about working at the health center is that there's all these people from all over the world that are in one place working together for one mission. So we have people who speak Arabic, Khmer, Swahili, Nepali, and they're all working at the health center. And it's just amazing to see the faces of our patients when they encounter somebody who speaks their language, who comes from their culture. Around 70% of our employees speak another language. When people hear their language spoken, it's always a benefit. But when there's actually somebody that actually embodies that culture, that language, it's even an extra level of comfort.
Especially in an environment where you feel vulnerable or nervous or anxious about what's going on in terms of your health care, to have that connection must be absolutely incredible. But I wanted to talk about the Black Lives Matter movement. It's been a wild, unprecedented year this year. The pandemic has laid bare many of the deep injustices in our society and specifically in our healthcare systems. How has that impacted the Lynn Community Health Center? How have you guys responded to your community?
We were lucky enough that the health center movement started in the 60s, and it started as a social justice movement. The model of the health centers has always been, let's find people who are being discriminated against. Let's find people who are not able to access care simply because of either the color of their skin or the lack of heft in their wallet. And let's provide that care for them. In the health center movement, we already knew that going in. So we didn't have to do all that work to accept the reality. And the health center has always been a place of empowerment. In terms of Black Lives Matter, we had already started work around racial equity the summer before COVID started. by coincidence, Boston DPH had been running trainings around racial equity and healthcare leadership. Fortunately, we discovered that on the pay side, no issues. There was no discrimination trend. There was nothing there, whether it's by ethnic group, by race, or by gender. But in terms of promotions, we did notice that even though people of color represent about 2/3 of the people who work in the front line, in terms of first-time promotions, so meaning these are promotions that where we promote from our own people to be supervisors, so that first step. In that first step, we were already favoring white employees. That came as somewhat of a shock to us. It's never something we had tracked, right? You don't notice it when you're making these one-on-one decisions, right? But when we looked at it, we're like, oh, okay, so now we need a program where we make sure that we are identifying promising people on the front line, that we're providing them with that kind of support and training so that they can be ready to apply for leadership and managerial positions. Now, there's things that we need to do as an institution to make sure that the wrong things are not happening. But the majority of this work is really internal work at individual level. As an institution, we have to provide the space and the platforms for people to engage in discussion and to really confront themselves. It's not really about confronting other people. It's really about confronting your own thoughts.
How has this year been for you in terms of managing your staff in a way that has been unprecedented in terms of their workflows have changed, how they work have changed, working from home?
So I've been CEO for 3 years now, and it's my first job as CEO. And I would say that this past year has really been a coming of age for me. As a generally egalitarian person who's been heavily influenced by Quaker ideas and Quaker thinking from my college, embracing the mantle of leadership has always been somewhat of an ambivalent issue for me. And this crisis really revealed that it doesn't really matter what I think. What really matters is what does the institution need? And sometimes in a moment of crisis, the institution really needs the leader to just say, this is the crystallization of the values that we all share. And this is the direction in which we're moving based on those values, and to be very explicit about it. There is this great worry all the time that I had about the employees and the staff. Psychologically, how are they doing? Spiritually, how are they doing? And I would say that I still worry about that. I would say it's been one of the most stressful moments of my life, but also one of the most formative periods of my life. And I'm sure I'll be looking back at this period for 20 years, 30 years, and sort of deconstructing what happened to me during that period. So it's also been one of the most rewarding.
I'm curious, from where we are now, what are you looking forward to in the coming months? What are you hoping for? What are you expecting? Where's your mind at right now in terms of what's happening right now?
So I'm really hoping that we can continue riding as a society this dramatic wave of wanting to fight against racism and wanting to fight against the historical injustices that we've had. It is my great hope that at the health center, we'll be able to design our telewellness at LCHC, and we'll be able to design it so all those components of telehealth actually help address inequities and injustices as opposed to maintaining them. I'm also very hopeful that our work to become an anti-racist institution will mean that we're going to have so many more career opportunities for our staff, that we'll be able to support them. And I'm really hoping that this sense of community that we've had in Lynn, we can continue, that we can leverage that for other issues that are not as in your face, but that do exist in Lynn.
Well, that is the end of our time. Kiyami, this has been an absolute delight. Thank you so much for making the time to talk to me. Thank you so much for all of your thoughtful answers to all of these questions. This has been incredibly informative to me. I've learned a lot. If anyone is watching in the audience right now and you would like to learn more about the Lynn Community Health Center, how to support it, what it does, please visit lchcnet.org/donate. Thank you for joining us. Thanks, Kiami, for having me. This was wonderful.
It was a great experience. So thanks so much, Jason.
All right, we hope you enjoyed that short introduction to what constitutes a federally qualified health center, our introduction to our mission and our roots in social justice. We'll open it up now for questions through that Q&A function that we mentioned earlier. We'll see how many we can get to today. We'll start off with a question for Kiyami and Bill. Kiyami introduced previously, he's joined by our co-founder, Bill Mantzoukas. In the video, saw the beginnings of the Community Health Center movement. Our roots as a counseling center, however, are pretty unique. So Bill and Kiyami, could you both share a bit about how we, LCHC, became part of the Federally Qualified Health Centers program?
Yeah, I think this is a great story, and I think people will be most interested in hearing from Bill from the beginnings, who really has seen our evolution over the last 50 years, including a board member for 30 years. So could you share a little bit about that, just that growth, the changes, everything that's happened?
Oh my goodness, it's monumental what's happened when you really think about it. Back then, I was right at the beginning of the whole community health center movement in the early 70s. The way I remember it is that there was such, during the 50s and 60s, with all of the industries in inner cities, shoe factories, et cetera, closing all over the country, and jobs going at that time to the south, and then eventually moving overseas. The inner cities right across the country were hollowed out. Lynn at one point had a population of over 100,000 people. During that period of time in the 60s and 70s, I remember a period where it was about 65,000 people. That's the impact that population shift had on not just Lynn, but all industrial cities in the country. The other issue that happened was the advent of Medicaid and Lyndon Johnson's War on Poverty that established a whole series of programs, and one of them was the Model Cities program. And what Model Cities did was identify the Model Cities federal program, identify cities that were moving in the wrong direction, if you will, economically, and pouring resources into those communities. And what they did in the city of Lynn and all over the country. In Lynn, I think there were like 30 programs, housing programs that Model Cities program developed, housing programs, the Community Minority Cultural Center was developed at that point. GLIS, for goodness sakes, was developed at that time, and the health center. Of those 30 some odd programs, only a handful survive to this day. The health center, GLIS, Community Minority Cultural Center, some housing programs that were taken over by the city, etc. So it was really Medicaid, Model Cities, and the hollowing out of Lynn and other cities that made it possible for the health center to start. And the other factor that was happening exactly the same time was that there was a huge push during that period for deinstitutionalizing mental health hospitals. Danvers State Hospital in Danvers was a monstrously big mental health facilities that opened up in the early 1900s, if not 1880s, 1890s. It closed in the 70s completely. And those, my goodness, thousands of people that were being taken care of were moved out into the community. And communities like Lynn, very honestly, saw the impact of a lot of those folks coming into Lynn, into Haverhill, into Salem, et cetera, et cetera, et cetera. And that impacted the city. And one of the biggest issue that Model Cities provided was for Danvers State Hospital to provide services to Lynn during that deinstitutionalization process. And they were willing to provide a psychiatrist, Dr. Alexander, a psychiatrist, a psychologist, Steve Hayes, a young, newly minted psychologist, a couple of social workers, et cetera, to come to Lynn under the Model City program and establish services, mental health services for the city, but also for the folks that were coming from Danvers State at the time. And then I came along with my background and started really looking at our genesis as a counseling center and began to move it toward a full community health center. We were, as I remember, we were the only health center, maybe in the country, that started off with a counseling program, a behavioral health program. Every other health center started off with pediatrics, adult health, et cetera, et cetera. So our foundation was built on something very different for the health center movement, which I think is fascinating. And because of that difference, the health center has been a leader from that point on in the integration of behavioral health with physical health services. And that's huge. And that makes the Lynn Health Center very, very different and very dynamic, I think, because of that. That's it. That's sort of the beginning as I see it. Anything else?
It's still not surprising that our behavioral health core is still bigger than our medical core in terms of
It's
clinician,
interesting.
right?
Yeah.
And it's also not surprising that we were one of the health centers that adopted first this idea that we should treat substance use disorder, right? Which is really
That's right.
This orphan specialty that's seen as this orphan specialty, neither mental health nor medical, right? Like, and so it's not surprising that we started early at one of the big programs.
Yeah, I remember before I left that Steve and I are putting together a proposal to Mass Mental Health Department to do the first substance abuse program. I left after that. I think the program was funded, and it was, again, a small program, but a genesis. It was a beginning of what is now a monumental program and a monumental health center.
We'll go to one other question, and then I do see some questions are coming in the chat as well. And it's interesting. It's all sort of about this integrated care and the clinical expertise that we do provide in the City of Lynn. Bill, in talking about the history, you mentioned this phrase, the hollowing out of cities and attracting some of the talent to the health center as we were starting. So can you speak to that a little bit more in terms of the clinical excellence of the providers and staff at that time? Just briefly, then Kiyami, I think there's probably a lot to add around where we are now, which still fits, right, and how we're serving the population of Lynn.
We've always, health centers in general, the Lynn Health Center has always had the reputational baggage to overcome. Oh, it's really not a medical facility. Oh, the doctors there aren't real doctors. Oh, this or that. I think that is obliterated at this point. But at the beginning, it was a major issue in the community. Our physicians in the community that had left the city for Swampscott and Marblehead, et cetera, we weren't thought of very highly. It took me a year and a half to get a meeting with the executive director of then Lynn Hospital to just get introduced and introduce the health center to him. They just wouldn't listen to us, So we kept badgering and moving ahead and hiring good people and hiring better people and hiring and better and better and better. That issue of quality has plagued us from the beginning. And I think my belief is we're right now at the cusp of putting that to bed, with Kiyami as a leader and with where the health center is now as a real major ambulatory health provider, not only in Lynn, but in the North Shore. I believe, not exactly sure, Kiyami, we're the largest provider of community health and ambulatory care services in the North Shore, aside from a hospital setting.
Right.
Think about that. From that little health center providing counseling services now to being not just a provider of wonderful services, but we're getting into the realm of really impacting the healthcare scenario at a major level beyond the walls of the health center.
And I think you're correct that our relationship with the hospital has really evolved tremendously in the last 15 years. We really are hand in hand now.
Right.
All of our clinicians get credentialed and privileged through the hospital. We're board certified in all of our and licensed in all of our different services. It's not a volunteer type basement organization, right? This is hundreds of people who are finally educated. I mean, we're lucky that we're also in Massachusetts, right, where we produce a tremendous amount of professionals. I think that you're correct. There's less of this idea that we are somehow less than the rest of the system. And one of the silver linings of the pandemic is essentially many of the players and stakeholders in and around the city naturally thought, oh yeah, Lynn Community Health Center should be able to handle this.
Interesting.
There
Yeah.
was no like, maybe we should bring in somebody else. Nobody was surprised that we stood up a large volume vaccination site. Nobody was surprised that we were doing most of the testing. Like it was just an acceptance of our level of professionalism. We're one of the only health centers that's ever gotten a grant from the CDC to run a community program. That was the medical director of our specialty teams. And so here we have an infectious disease specialist who's operating on a federal level. We have come a long way in terms of being recognized. I think we've always done excellent work, but I think that really the last 10 years have really seen a breakthrough in the recognition that we get from our local and our regional stakeholders.
Right. I've seen it.
Exciting to hear both perspectives, I think, at this point. What do you believe the long-term impacts of COVID will be on your patients? And what will LCHC need in order to meet those different or evolving needs? Kiyami, maybe you could start us off with this one.
Yeah, I mean, Kristen has probably heard me talk about this before, but if you like zoom out, right? Like if you sort of take a look at the way Bill was talking about how we started as a mental health center as a response to some of the changes that were happening in society. I think if you look at the history of the world, there have been these major changes in societies after pandemics, right? The Renaissance came after a pandemic. All these huge changes that happen, and it's hard for us to predict where society is going to go. But what I do think is the elevation of racial inequities, the elevation of poverty as this incredibly unfair force that impacts people. I think COVID changed a lot of people's minds. I think we've been attached to this narrative that people are poor because they're not working hard enough, or they're not making the right moral choices, or they're not right. And I think the pandemic showed that, you can become poor just because. Like, there doesn't have to be a reason. Like, it's just things fall apart, right? Like, I think the big change I'm seeing really is that the vulnerabilities and the plights that our patients suffer from, those are going to be elevated and will become priorities for all kinds of leaders, political, business, spiritual. I think it's going to become a topic that will always have to be addressed. And I'm also hoping that we can help prevent some of the coming inequities. I think the digital inequities are really one sort of the next rising inequity. And I think that if the COVID really pushed us to consider these inequities and really think, it's our responsibility to really do something and prevent the inequity from actually growing to its full potential. I really see COVID as having opened people's eyes and also opening doors for us to have more collaborations with people that before we didn't necessarily interact with. So I actually have a lot of hope for our community and for our patients. And I think it also, interestingly enough, COVID forced us to honor the community in our name. We're a community health center, and COVID really forced us to get out of our four walls, forced us to stop just looking at what's happening in our offices and to really go out there and start once again, rejoin where we started from, which is what's happening in the community. What does the community need us to do? And how are we going to make sure that we are amplifying the voice of the community as opposed to simply interpreting from our perspective what the community needs?
That makes a lot of sense. It's sort of a perfect segue into this next question. Both of you have served as one of the top leaders in this organization at very different times, and also not so different times. Video, Kiyami, you talked about embracing the mantle of leadership. And Bill, you've mentioned that the health center has most often been guided by the right leader for the right time over the course of its history. And there's been continuity from folks like yourself, Bill, and you also mentioned our other co-founder, Steve Hayes. What can you both share? I think we're close to time, but what can you both share about your experiences as leaders of the health center? Bill, maybe we can start with you this time.
As I look back, it is really fascinating to me that it was the right leaders at the right time. Beth Babcock as the executive director for, I think, 12 or to 14 years. I forgot. And what she did, I think she came in about 6 or 7 years after we started the health center, something like that. Maybe more. I apologize. But what she did was really stabilize the health center from its beginning stages of an organization are really shaky. And she stabilized it, grew it, put together some fabulous systems, hired some great people, and so forth. She leaves, and then we get Lori Berry here, who took over and was for 21 years director. And Lori took that health center and just blew it up. The health center movement during her years was really in a growth mode. And the Lynn Community Health Center grew like crazy in an appropriate way and became a foundation in the community through her leadership. Now we get Kiyami, and Kiyami comes in and in my view, takes an established, well-functioning health center with, what is it, Kiyami? 140,000 patient visits a year, a very, strong, sizable organization, and is taking it to the next level. And the next level, as he said, was outside our walls. And what does it mean to be a health center in the 2020s? What does it mean to the community for the health center to be part of something greater than itself? And it feels right to me. Kiame, I may be wrong, but that feels right to me. It feels right what Lori Berry did, what Beth did, and what I did, frankly, in the beginning. We're very fortunate. Four people for over 40 years of our 50-year existence. Unusual for an organization. And that's what makes us very stable, I think. There was Steve Hayes. Steve Hayes was there for 45 of those 50 years. And Steve was the conscience of the health center. Steve was the pain in the neck that said, remember what we're here for. Remember why we started. Remember that you're not as important, Mr. Department Head, as the community we serve. Remember our mission. All those leaders were fantastic, absolutely fantastic. We're blessed to have all of them and blessed to have Kiyami with us now.
One of the things that's also interesting is that I'm still in touch with Bill, and I'm still monthly in touch with Lori Berry, right? So there's this continuity, and I really see myself whenever I'm faced with a thorny problem, I'll turn back to Bill, I'll turn back to Lori and say, well, what do you guys think? Because certain ethical and moral questions never really go out of style, right? They're always the same thorny dilemmas. Yeah, it'll be interesting to see what my leadership sort of legacy ends up being. But I think the legacy from Bill and Lori and Beth, whom I don't know as well, but has really been, how do you take these resources? Because we're an institution that's able to attract resources, right? And historically, Lynn had a difficult time doing that. Now it's changing, but since we're able to attract 40, 60, $80 million a year into Lynn, how do we use the power of the institution to elevate the mission, to elevate what we're doing? And I think one of the big changes that's really happening now is we're moving from being people who provide healthcare to pretty soon being people who are trying to provide wellness, right? And I think that the shift that society is making and that we're leading that change in Lynn. So I'm actually, sort of interesting thinking the different challenges. When Bill started, the challenge was there was no money, right? There was just no money, right? You had to scrounge everywhere to get every dollar. And now, like you mentioned, there's all these supports that exist federally, statewide, regionally. So now the issue is more, how do we use those resources to its maximum capability in the fulfillment of our mission. The role of the leadership keeps changing, but it's always anchored in the same place. Of our most vulnerable, of our most disenfranchised, how do we leverage those resources so that our staff, our patients fully are able to participate in the greatness that's available in our society today, as opposed to seeing people as being condemned to living in a particular strata or in a particular place. So that's a good question, Chris, in terms of leadership. And I think that I struggle with it all the time. How do you listen? How you are a servant leader, and yet at the same time provide people with the direction and the reassurance that they have a leader who knows what he or she is doing?
No shortage of complexities or nuance for sure.
Well, and that's real leadership. That's real leadership,
Absolutely.
and you don't find that often, frankly.
Well, we are very lucky to have you both involved with Lynn Community Health Center, that's for sure. That is just about all the time we have tonight for our discussion. To our participants, thank you again so much for joining, and I will turn it over to Kiyami to close us out for the evening. Kiyami?
Yes, I think before I close it out, I think I'd like to bring back Jason. I thought maybe I'd give him a chance to say hi to his father,
Great. That was great. What a great chat. I loved watching this. And yes, it is great to see my dad. What a delight in the house that I grew up in. Wild stuff. This was wonderful. I've just been sitting here just delighted by this conversation. Thanks so much for having me. And thanks so much for inviting me to be a part of this series. It really has been, incredible to kind of dig in and learn a lot and kind of have this conversation. Has been really exciting. And I'm very much looking forward, hopefully, to the third installment. And then I guess we'll do a series of prequels that explain kind of what came before. And then we'll see what happens from then on.
That's right. No, and I thank you, Jason, so much for giving your time. And you probably realize it, but there are very few things that make a father happier than having their children sort of recognize the work that they do, and not just the person who makes them eat their vegetables at the dinner table, So it's been great seeing you interact in that way. And I want to also thank Bill for his time, not just in the video, but in general, for occasionally giving me a swift kick in the pants to shape up and get out there and not feel so sorry for myself. But I also wanted to thank, all of you out there, the foundations, the organizations, donors alike, for all the trust that you've put in the health center through your support, both financial and also through advice. We're still in our fundraising mode, and any funds that we raise go to unrestricted, which means that for us, it just goes to the service that's doing the most, but getting the least amount of revenue, right? That's sort of how we allocate our unrestricted funds, because we still do a number of things that essentially make zero money, but that we feel compelled to do because we just need to do it for our community. COVID proved that we're able to pivot and do all kinds of things thanks to your support, because yes, federal help did come in the end, but the way we're able to continue and piece our work together was really through small and medium-sized donors and local foundations. So again, thank you so much for the help that you've provided. And again, thanks to Jason, thanks Bill. And again, our sponsors, presenting sponsors, Cambridge Savings Bank, Sean Lobdell, and Stainless Communication, thank you so much. And our major sponsors, once more, Commonwealth Radiology Associates, Eastern Bank, and Mass General Brigham. And so all of you also who've joined the discussion, many thanks for giving up some time on a beautiful summer evening. And like Jason said, pretty soon we will have an episode with Ewoks coming your way. And we're hoping to see you guys again. So thanks again, the Mantzoukas father and son duo.
Oh, my pleasure. Yeah, thanks.
Thanks so much. What a delight.
Okay, yeah, what a delight.
Stay safe, everybody.